the VCA Voice podcast. I'm your host, Dr. Marie Curl. Our goal with the VCA Voice is to showcase how VCA Animal Hospitals is taking care of the future of veterinary medicine. We'll bring our purpose to life through meaningful conversations about care, our culture, and the communities we serve. On today's episode, I'm happy to welcome Dr. Wendy Deal. Dr. Deal is an associate veterinarian at VCA Mill Run Animal Hospital in Columbus, Ohio, and is also an area medical director for VCA's Midwest group. Hi, Wendy. How are you today?
I'm well, thank you. How are you?
I'm well. I'm so thankful you were able to join me, and I want to get started right away. So tell me a little bit about your journey in veterinary medicine and how you got started.
So I was a late bloomer. I didn't decide to go to vet school or apply to vet school until after college. So I ended up taking pre-vet coursework at night after work for about 4 years. Then I started vet school at Cornell when I was 29. I graduated in 2003 and I completed a small animal internship at Ocean State Veterinary Specialists in Rhode Island. Then I went and worked at a small private practice in Rhode Island for another year before I moved back to Columbus, which is my hometown, in 2005.
Before you started your pre-vet requirements, what did you study in undergraduate?
So my degree is in education and social policy. Then I actually got a graduate degree, master's in natural resource policy. So I was working in Boston at a nonprofit, an environmental nonprofit, when I decided to go back to vet school.
So how long have you been on staff at VCA Mill Run Animal Hospital?
So I've been there for about 19 years.
Okay.
It was the first job that I got when I moved back to Columbus in 2005.
Wow. So you've been there a long time. Has it been a VCA all that time, or was it acquired while you've been there?
It was actually acquired right after they hired me. So I was hired, and then right before I started, it became VCA. So since I've worked there, it's been VCA.
Were you nervous about that?
I really was. I didn't really know that much,
Okay.
right? I mean, I was glad to have a job, and, it was the same hospital, right? So it didn't feel like it was any different for me in terms of the people who interviewed me and things like that.
So tell me a little bit about your hospital and what areas of primary care you really enjoy.
Yeah. So Mill Run is a really busy practice. We're a hybrid practice. We've grown from when I started, we were 4.5 doctors, and now we're 9 doctors. We're now open 7 days a week. And we see a range of basic wellness to more advanced medicine cases. We do a lot of surgery, including orthopedics. We have 2 doctors that do orthopedics. I personally am not a surgeon. So I'm fortunate to be at a practice where I don't have to be a surgeon. I don't have to do surgery. And I was able to develop skills in ultrasound and really able to pursue more medicine type cases. So I'm sort of an internist by nature. That's what I tend to focus on. My favorite part of primary care versus maybe a specialty or ER practice is that long-term relationship that I can build with clients. I think that's just so rewarding to work with the same clients year after year and get to know them and know their families and their pets. I've certainly had clients where I've worked with numerous pets in their family, and that's probably my favorite part.
When did you become an area medical director, and what does that role involve?
So I became an AMD for Central Ohio in 2021. And I consider it to be just a support role. So I go in and support doctors, help them with, different cases, medical SOPs, ultrasound training. I also really believe that it's important for doctors to utilize their staff to the top of their abilities. And so I really try to go in and encourage them to work on training their staff to help them with their own efficiency and productivity. I'm really a believer in relying on your staff and believing in them and trusting them. I also then help our ROD with her regional leadership responsibilities and meetings, working with HMs and tech soups, things like that. And of course, I also assist our regional medical director with regional meetings, new graduate meetings, associate doctor meetings, and local CE.
I'm so glad that you brought up the relationship of veterinarians with credentialed veterinary technicians and veterinary assistants. For those who are listening who may not really understand the differences in the roles, Let's say a patient comes into the hospital. What would the veterinarian do? And then what would the credentialed veterinary technician and or veterinary assistant do in that appointment?
The veterinary assistants are really crucial in helping move through the rooms. We tend to have more assistants than credentialed technicians. So they really keep the flow going. They check in rooms, they TPR, they assist the technicians in doing more advanced things like blood draws. They get medications ready. They talk to clients about instructions. The veterinarian is obviously doing the exam and diagnosis and treatment plan.
Mm-hmm.
The credentialed techs, it depends on the state, right? In Ohio, assistants can do a fair amount. They can draw blood and things like that. But for anything more advanced, like catheter placement, filling of controlled drugs, certainly surgery, that's where our credentialed techs come in. We try to have a credentialed tech, which for those who are not familiar with veterinary medicine is really more like an RN. So a registered nurse, someone who can do a little bit more. So we try to have at least one technician on every shift because they are going to be more capable of doing things like if we hospitalize a patient, getting that patient set up on IV fluids, et cetera. All of our assistants, we train to do pretty much anything that they're allowed to do by law. So again, we really encourage them to get those skills, which I think provides the engagement that is so crucial to reducing turnover at hospitals. We have so many of our staff that started in kennel, then became veterinary assistants, then went to tech school, became credentialed techs, and then of course we have some that went on to vet school.
Mm-hmm.
So it's really important, I think, to understand what your staff is capable of and allow them to do what they're trained to do.
I know you're very passionate about early career veterinary training, and honestly, listening to your training experiences also with staff really just all fits that. How much does your education background have to do with your interest in all of those areas?
Yeah, that's a good question. My degree is in education and social policy, but it wasn't a teaching degree. That was just the school.
Mm-hmm.
I was essentially more than the social policy track.
Okay.
It was honestly a major I chose because I had no idea really what I wanted to do. And
who does when they're an undergraduate?
Right?
Nobody.
So a friend of mine was in that major and she really liked the courses that she was taking. And so it was because you could take a mix of sociology and psychology and things like that. And I thought, well, this sounds good. I really enjoy communicating with people. I love writing and I love learning. So when I was in vet school, I just tell people I loved vet school. I loved learning about things. I loved being in clinics. I was there all the time. I really wanted to go into academia, but I didn't match for the internship at first.
Mm-hmm.
I got my internship out of the match. And actually a friend of mine said, she's like, well, you can teach your clients, that's
Mm-hmm.
those can be your students. And, she was absolutely right because that love of communicating with people and communicating ideas to people, that is what veterinary medicine is. Like, as much as we think it's about animals and about the medicine, obviously it's about those things, but it's really also about making sure that your clients understand what's going on, being able to explain what's going on, reassure them, communicating with them on their level. That is teaching, right? So that's kind of, in my mind, how I started. And then because of our proximity to the vet school here in Columbus, we always have vet students working as assistants. And so from this beginning, I've been working with vet students and teaching them as we go along and answering their questions. And I just love that. So then that just became the mentorship program just became an extension of that, and working with the new grads. So that's my journey in education, kind of started a long time ago. Just continues to develop.
Well, all excellent points. And since you work so closely, both with vet students, but also with new graduates, can you recall any of the feelings or emotions you had when you first started your internship, your first position as a veterinarian?
Yeah, I'm really glad you asked that because this is a conversation I have with vet students all the time. So I go to Columbus Humane. I speak to the students on their shelter rotation every couple of weeks. And this comes up a lot, which is like, well, how do I prepare? Right? Because they're in their fourth year, they're getting ready, they're thinking about working. And I was so unprepared. For me, it was really emotional. I tell people I cried every day on my internship.
As some interns do.
Yeah. Maybe an exaggeration, but it was a very stressful time, and I didn't feel the medicine wasn't as big a deal, right? Like you're getting the medicine and you can look stuff up. It was more just that now I'm the person that has to have the answers. The people are looking to me, not just the clients, but the technicians. I mean, the technicians understand, they know you're an intern, but that was really difficult. And also just how to be a professional. Some of those leadership skills, professional skills, right? Communication skills. Those are all things that you really are developing on the job because you just don't really get a chance to learn that. So much of it is on the job learning. And you have to be okay with that. And you have to understand that, right? I think for new grads, they don't know enough about imposter syndrome. So they think what they're feeling. They don't understand that everybody feels this way when they start. So I talk to students about that a lot. I said, you won't be prepared as much as you try, but it's okay because no one else is prepared either. And if you're in a good situation, you will get the support and you'll get that training. You just have to trust the process.
So, at the time you graduated, and I also took the path of doing a rotating internship, but most veterinary graduates go straight into a practice position, and that really is honestly quite common in veterinary medicine. So why is it so important to have a structured mentorship program for those veterinarians who are entering into primary care or emergency care?
If a mentorship program had been available when I went through, I might have chosen that path. An internship was really the only option for me. And I needed it. I 100% needed that. I needed the guidance in a supportive environment. So I think having that structured mentorship is really valuable. Again, the medicine usually is there for the most part. It's not really about, yes, you're learning how to go through the diagnostic process and you're learning surgery and all that. And that's obviously crucial. But it's also all those soft skills that you don't get an opportunity to learn, and having someone there to model that professional behavior, helping you through and understanding that this is where you can get, but it's okay that you're not there now.
Wendy, we launched the VCA Academy Mentorship Program nationally in 2019. Can you share with me a little bit about how that program works for both the mentees and for the mentors and hospitals?
Sure. So for the mentee, the program is 6 months. The first 3 months are much more structured. They start out usually by shadowing their mentor and other doctors in the hospital, both in appointments and in surgical procedures. And then as they go along, they start to see appointments in tandem with their mentor or see their mentor's appointments. And then they move into seeing their own appointments with longer appointment slots. And it's structured for the mentor in terms of having time to teach and work with those mentees. The structure of the mentorship provides financial support for both the mentor and the mentee during that process when the mentee's not seeing as many of their own appointments. And sometimes the mentor can't see as many as they normally would in order to have time for teaching. Then after those first 3 months, most of those mentees are going to be seeing their own appointments. And so they're seeing a more regular pace, and their mentor can go back to seeing their own regular pace, but there's still support, right? So there's still the guidance they need, help, especially with surgeries. I find that most of the time the outpatient stuff gets a lot easier, but there's still a lot of surgical procedures that they'll need help with, even for the first, honestly, it's going to be for the first few years, but that first 6 months, especially having the opportunity to get that support.
Excellent. And what about the weekly coaching sessions? Does that happen?
Yeah. So one of the other important parts of the program is that opportunity for one-on-one coaching and feedback. So while the structure of the mentorship is adaptable to the hospital. What we really want each hospital to do for sure is have those one-on-one meetings and really schedule the time to make sure they don't get missed, because it can be very easy to, when you're busy, to not do them. And they provide feedback on both for both parties, right? So it's an opportunity for the mentor to talk about areas of improvement, areas that the mentee is doing well and things to continue to improve on, but also an opportunity for the mentee to provide feedback to the mentor. Like, I really would like more guidance on this, or I'm having trouble with this staff member, or I can't seem to have a good conversation with clients about X, Y, or Z. So it's really a great way to form that relationship and make sure that we're not leaving things till the end, right? The feedback is best when it's timely. And so that gives an opportunity for that feedback to be done, when it's going to be most important.
What can you say about the art of being a good mentor, and what are some of the challenges of mentoring?
I think one of the biggest challenges is the time. I think that a lot of new mentors who haven't done it before, that's one of the biggest or most frequent questions I get is, how do you find the time in your day to teach because you really want to? And that is a challenge. The way I do it, if I have someone who's working with me on the floor, is I just essentially have them see my appointments so that we have time to talk. But we're not doing parallel, right? We're doing them the same appointments. So that's kind of how I would structure it. I also just tell people sometimes you're just going to maybe stay later doing your records. Unfortunately, it's just part of it. But yes, that's probably the biggest challenge for mentors, because we're also so used to our pace, right? We get this consistent pace, and having a mentee it just completely interrupts. Just because you're answering questions and things that you don't even think about that you have to go over. And, you're used to just not having to explain things, right? You're just going through in your own mind. And so everything you're explaining. So that's just part of it. But it's rewarding too. And I think most people that sign up to be mentors, they like that, right? That's why they want to be mentors. So it's not a big issue for them.
Do they ask you questions you don't know the answer to?
Oh yeah. Well, that's when you get good at saying, well, what do you think? What do you think the answer is? That's usually, why don't you go look that up and
why
let
don't
me
you
know?
go look that up is a good one.
Yeah. Yeah. Which is, that was done to me too. So yes, sometimes or just admit that you don't know the answer. It's a good skill to have too. The other thing I tell students and new grads is just don't be afraid to say, I don't know, because people would rather have you say, I don't know, than try to BS your way through something. The art of being a good mentor is really learning how to see things from someone else's perspective and how to listen. We think we know what we're talking about all the time. And sometimes someone's asking us something different than what we're hearing. Sometimes they don't know how to ask for help. Part of being a mentor is understanding where they need improvement and guidance, even if they don't know that they need guidance in that area. So you really have to be able to listen to them and also observe and be able to give feedback in a constructive way.
So veterinarians know that there's many different ways to approach cases, make diagnoses, and manage illnesses. So how do you support mentees who want to try an approach based on their education that might be different than what you usually do?
I think you really have to be open, right? Especially the older you are, the more experience you have, the more open you have to be that there are new ways to do things. That's medicine, right? Medicine is always evolving, and you really have to be able to embrace that. So I like learning, so it's always interesting for me. I like to hear about new things, new ways of approaching things. I do try to do my own research. So certainly I want to make sure, I would ask the mentee to, provide information or sources where where are they getting this? And I do a little bit of my own research if it's something I'm not familiar with. Occasionally you'll get someone who's misinterpreted something. So they want to do something because they read their notes wrong or they just misheard or whatever it is. And so going through that, you realize. So I really like when they have a different way to do things and that opportunity to learn from them. That said, one of the problems we sometimes run into is that the staff don't always like it
when
that's doctors want to do it differently. So that's also something you have to explain to the staff, right? Because the staff get used to, okay, well, Dr. Deal does it this way. Mm-hmm. And so when, Dr. Curl comes in and she wants to do it this way, and they're like, well, what does she know? Or they'll try to, especially when they're new grads and they're young, they want to try to boss them. Some of our techs want to try to boss them around a little bit. So that can be a challenge. So there is sometimes some reminding of the staff that, no, it's okay. It's okay. We try it this way. And also that there are multiple ways to do things. And just because we do it this way, but this doctor does it this way, she's going to get to the same result, or, it's fine. Right. So, that's certainly something that we've dealt with over the years.
That's a really interesting point. I hadn't even thought of that, because I always look at it, again, from my experience, that I've learned so much from technicians when I wasn't sure, very, very young in my career, when I wasn't sure what to do. They were a huge source of support. And yes, I've absolutely seen that the opposite way, that they're very uncomfortable with doing something that is different than has happened in their practice. So that guidance and coaching is hugely important as well.
Well, and I also, to your point, I always tell new grads, like, ask the technicians, or if the technicians are telling you something, you can listen to. I mean, I learned, just like you, I learned so much on my internship from the technicians. Right. If you work with skilled technicians, they can teach you a lot.
What are some of the things that your mentees teach you?
Well, obviously, new medical information, knowledge, techniques, obviously. But I would say humility. You get older and more experienced. Sometimes you just, you think, I tend to be a little bit of a know-it-all anyway. So sometimes it's good for someone to kind of let me know there's a different way to do things. I think how to be less judgmental, how to listen better, how to see things from other perspectives. And I'm still learning on how to provide good feedback. I tend to want to fill awkward silences. And so I'm trying to learn a little bit better how to give the other person space to say what they need to say. I have to learn from them, how to give them the opportunity to provide me with feedback as well. So I also have to be open.
Well, we are nearing the end of our time together. And in closing, what advice do you have for veterinary students about how to find the right mentor for them?
So ideally, finding someone with the right combination of clinical experience and medical expertise, but also a similar professional style. My first job after my internship, I worked for a doctor who was very skilled and respected, a great doctor. But ultimately, I felt like she didn't really get me. Wasn't really the perfect fit for me, culture-wise, in the hospital. But I would also say that for new grads to temper your expectations, because for the most part, you're probably not going to have your perfect job as your first job, but there's still always something to learn. So you can learn from everybody that you work with. The most important thing is to find a place where you feel supported and understood as you develop those skills and continue along in your career.
Great. Well, Wendy, as always, it's a pleasure speaking with you, and I'm so grateful for you joining me today to talk about the important topic of mentorship. So thank you.
Thank you so much. Thank you for having me.
Thank you so much for listening in. If you enjoyed today's episode, please consider subscribing. Don't forget to leave a review to let us know your thoughts, and share the episode with friends. Follow VCA Animal Hospitals on social media at LinkedIn, Facebook, and Instagram. For more inspiring stories, visit our website at vcavoice.com.